Okay, welcome back to our Imagist series on tips and tricks to improve your hematology and cytology samples. I'm Dr. Corey Yurokis, and I'm a clinical pathologist member of the VetScan Imagist digital cytology team. So I am on the other side of your Imagist reading your samples. And today's video is going to focus on just some sample collection basics. And we covered hematology before, so these are going to be your cytology samples. So let's get started. Okay, a couple different ways that we can collect our samples. We've got impression smears, swabs, an aspiration technique with a syringe attached, and an aspiration technique that does not have the syringe attached, which is my personal favorite and the one that I use all the time. Impression smears do have a place. They are usually most beneficial for dermatology samples, you know, the papules, the pustules, the crusts, things like that. But what it is limited value for are masses. So if you really have an ulcerated mass that you're worried about an infection and you want to do an impression smear, that's great. Just make sure that you're always pairing that impression smear with an aspirate of the mass itself, because impression smears are really only going to capture the surface of that mass and may actually miss what's actually going on down below. So impression smears of skin masses are always best paired with fine needle aspiration. Swabbing is usually what we can do when, skin scrapings or scrapes or cytology samples like aspiration, an impression smear isn't going to cut it. So this is going to be your vaginal cytology for reproductive samples or sampling the eye. So if the tissue is already damp, then you don't need to go ahead and dampen your swab. But if it is drier tissue, or it's something that's underneath the eye that you're not comfortable putting, a slide up against to take an impression smear of, then you want to make sure that you actually dampen the swab with some sterile saline, so that it can pick up the cells a little bit better, help them exfoliate from those drier tissues. But again, if the tissue is already damp or moist, you don't need to do that step. The aspiration and non-aspiration techniques are what we're going to look at next and are probably the ones that you're using the most. So for the aspiration technique that has a syringe attached, the best place for these are your cavitary effusions, your thoracic fluid, abdominal fluid, pericardial fluid, or any mass that feels like it's fluid filled on the inside, because we need the suction from that syringe to extract the fluid from those spaces. The other time you're going to attach the syringe is to a needle when you are aspirating your internal organs, livers, spleens, abdominal lymph nodes, things of that nature, mainly because we don't want air to go into the body cavity through the opening in the needle. So that's why we need to attach the syringe. But you're still going to use the redirection method, which we're going to talk to you next, rather than using suction on the syringe. Too much suction with the syringe can actually rupture the cells, and is counterproductive to what we're trying to do. So my favorite sample collection, and the one that I use the most, because it's usually lymph nodes and lumps and bumps that we're aspirating most often, is the they call it non-aspiration because you don't have a syringe on the back that you're pulling cells out of. So with this method, you're just holding the needle by the hub, preferably 20 to 22 gauge should get you there. 18 gauge is too big because that actually ends up being a biopsy almost, and all we really get is blood, and 25 is too little. We're not going to be able to get any usable cells with that tiny needle. So we want to go ahead with a 20 to 22 gauge needle. Always hold it by the hub, stabilize the mass or the lymph node with your other hand, and then you want to redirect that needle a few times in the mass so that we make sure that we're getting a couple of different angles and a couple of different areas when we're aspirating. Even for lymph nodes or even for the large masses, I would actually, if the animal is amenable, aspirate from a couple different directions, usually maybe the cranial end of the lymph node or the caudal end or the peripheral edges. So trying to really get a good picture of what's going on in those masses. The larger the mass, the more you want to stay to the periphery and not in the center. Those larger masses can tend to be really cavitated or even necrotic in the center. So if you're aspirating out at the edges, you're less likely to hit almost that gooey center of a mass. We don't want that. We don't want to just get necrosis on a slide, because that's really frustrating too, because we know we've missed what's going on. So stick to the periphery of those larger masses. Once we have our cells collected, what's absolutely essential is to get them onto the slide and spread out. It is so important to spread out any sample from anywhere that you've collected so that we can make a nice thin sample that's going to stain evenly and that we're going to be able to see. So we've got a few techniques that we can do. Cytology sample preps, my favorite one is the slide over slide or sandwich techniques. And down at the bottom there is a line prep technique, and that's usually going to be used for poorly cellular fluids or fluids that you can't make a concentrated prep out of. So let's go ahead and look at these methods a little bit closer and talk about when we would use them. So sample cytology preparation, the first one is the slide over slide technique. And this is one where you've aspirated your lymph node, you've aspirated your skin mass, and now we need to get that sample spread. So for this, you haven't had the syringe attached because we don't want to break our cells. So this, we do have to attach a syringe to get the cells out of the needle, right? So before you attach your syringe, you want to make sure it's already full with air and that the plunger is pulled back. Then go ahead and attach it to the needle. Sometimes at this point, it's very tempting to just pop the back of the syringe and squirt the sample onto the slide. But honestly, that makes the cells fall through the air and hit the slide, and then they're going to explode like they jumped out of a plane without their parachutes on. So we don't want that. So to minimize cell breakage at this crucial point, you want to actually touch the needle to the surface of the slide, turn the bevel to the side so you can see the opening, and then gently, not too slowly, but not too fast, gently express the material onto the slide, and then we can go ahead and smear it. So that's a first step to minimize cell breakage when you're getting the sample out of the needle. For the slide over slide technique, you have your sample slide, and then you're going to take your spreader slide, and you can either spread it perpendicular to the surface of the sample slide or parallel to the surface of the sample slide, whichever one you're most comfortable for. Sometimes if I'm having a stressful day, I tend to take it out on my cytology samples and push really hard when I am spreading my samples, and obviously that's going to Hulk smash all of our cells and our sample's not going to be usable. So if you feel that you are a little bit heavy-handed when you make your smears, I would actually lift this sample slide, the slide with the sample on it, up above the tabletop, and then I would actually smear it with my smear slide up in midair, because that way I don't have a table that I'm pushing down on. So I would usually hold my slide with the sample in my left hand, take my smear slide, and either touch it gently to the slide, and then either take the spreader slide and spread it parallel, or turn it perpendicular to the sample slide and spread it evenly. Either way, you're going to make a really nice, thin, even smear that's going to stain really, really well. For the line preparation technique, for any of your fluid samples, you want to make sure that you are submitting a direct and a concentrated sample. And this is for cystic fluids from masses, but especially the cavitary effusions, thoracic, abdominal, pericardial. For a direct smear, you can either use the slide over slide technique that we just talked about, or you can even use a blood smear technique if it's a thinner fluid. For a concentrated preparation, we do different things with both of the preparations. The direct smear is where we're going to assess cellularity. We're going to look at the background for how proteinaceous it is. But sometimes on the direct smear, looking at morphology can be a little bit challenging for the cells that are there. So the concentrated prep is actually going to take some of that proteinaceous background out and improve what we can see in terms of cell morphology, and also help us look for bacteria and other infectious agents. How do you do that? You do it the same way, ideally, that you prep a urine sediment. You spin the fluid down, pour off the supernatant, resuspend the pellet, and then make a smear. Again, either using a blood smear type technique or a slide over slide spread technique that we just talked about. If for some reason the centrifuge is out of use or it's broken or you just don't have access to it, one of the down and dirty ways that you can make a concentrated smear is to do what's called a line prep, which is what's shown here. So for this, you want to put a drop of your fluid on your slide, drag your spreader slide back, similar to the way that you did for a blood smear, and then go ahead and push the slide forward. But then you actually want to do a hard stop. So instead of lifting off at the edge of the slide like you do for a blood smear, you want to do a hard stop for this technique, and then just lift directly up. So you're making actually a concentrated line at the end of that fluid smear. So it's almost kind of two samples in one. It's a direct smear plus a concentrated line. And again, this is something that you want to reserve for if you can't centrifuge that sample at all. Hopefully, we reviewed some cytology sample spreading techniques. Hopefully you've gotten a few nuggets that you can actually take back and practice with your cytology samples. And I promise these are going to really improve the quality of the cells, improve the integrity of the cells. So then when we go ahead and stain it, we'll be able to see what we need to see and get a nice diagnostic result for you. So thank you so much for listening to this episode, and we'll see you next time.